Good morning. I am Terry Tropin, and today I'll be describing diagnosis coding for complications of neoplasm and treatment of neoplasm. Let me start with information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I'm also an HEMA-approved ICD-10 trainer. I taught health information technology at Montgomery College in Maryland for over 20 years. From these courses, I developed study guides which developed into these books. One on evaluation and management coding, one on ICD-10-CM coding, and one on PCS coding. These are available on Amazon and updated every year or as needed. Sometimes in the spring, they'll do new guidelines and I can update them when that happens. So here's an overview of what I'm going to talk about today. I'm going to talk about complications of neoplasms and neoplasm treatment related to anemia, dehydration, pain, surgical treatment, malignancy in a transplanted organ, pathological fractures, malignant pleural effusion, malignant ascites, and insertion of radioactive elements. The most important and probably confusing aspect of coding for these complications is the sequencing rules, and we'll go over that very carefully. So neoplasm codes, as you know, are available listed in your book in these categories, C's and D's sections. If you're not familiar with how to use the neoplasm table, which follows the alphabetic index in your ICD-10-CM book, see my YouTube video on using the neoplasm table. It can be somewhat confusing. Let's start with coding for anemia associated with a malignancy. So say the patient has anemia associated with cancer. Patient is seen during this visit only for treatment of the anemia. In this case, list first a code for the malignancy and then a code for anemia and neoplastic disease, which is D63.0. Sometimes the patient has anemia associated with their cancer, but during the visit, both the anemia and the malignancy are treated. That's a little bit different. In this case, list first a code for the malignancy and then a code for anemia and neoplastic disease. Note this is the same sequencing as in the previous circumstances. Anemia and then malignancy and then neoplasm, malignancy and then neoplasm. So far we're fairly straightforward. Sometimes a patient develops anemia not due to the cancer, but due to the treatment for the cancer. So for example, a patient may develop anemia due to chemotherapy. If only the anemia is treated during a specific visit, code first the anemia due to chemotherapy, which is D64.81, then the neoplasm code and the code for adverse effect, which is in the T section. The T45.1X5 code needs a final digit to indicate initial visit, subsequent visit, or sequelae. These are really easy to forget, so be sure that you add that. Sometimes a patient develops anemia due to immunotherapy. If only the anemia is treated during a specific visit, code first the code for anemia, D64.89, then neoplasm and the adverse effect of neoplasm code from the T section. Note that the anemia code is different than for chemotherapy. So for immunotherapy, you use D64.89. For chemotherapy, use D64.81. So these are very, very specific codes. Note again that the T45 code needs that final digit for encounter or sequelae. Okay, sometimes a patient develops anemia due to radiation therapy. In this case, if only the anemia is treated during this encounter, list first the code for other specified anemias, D64.89, then neoplasm and adverse effect. Note that the code for anemia is different than the one for chemotherapy or immunotherapy. This is a Y84.2 code from the external cause section. This is not the T code we had before. Sometimes the patient is treated for anemia due to chemotherapy, immunotherapy, radiation therapy, and the malignancy are both treated during the same visit. In this case, list first a code for the malignancy, and then anemia, and then the adverse effect, either the T code or the Y code. The main focus of this visit is the malignancy, and so that's why it's listed first. What if the patient is seen for chemotherapy, immunotherapy, or radiotherapy and develops anemia during that same visit? So this is a little bit different. So in this case, you're going to code first a Z51.1 code, encounter for treatment. That's listed first. So if it's chemotherapy, it's Z51.11. If it's immunotherapy, it's Z51.12. If it's radiation therapy, it's Z51.0. Okay, so that's listed first. Then list anemia due to treatment, whichever one of these is appropriate, the neoplasm code, and then the adverse effect code, whichever one of those is appropriate. So it's pretty much the same what we talked before, except the first code becomes the Z51.1 code. Okay, so let's do a practice. If you would like to code this on your own, pause the video, figure out what codes you would use, and then turn the video back on to check your work. So the practice question is, patient is seen for anemia due to metastatic bone cancer. Only the anemia is treated during this visit. Okay, so first you do secondary bone cancer. Then you do the D30.0 anemia and neoplastic disease. The guidelines state that the malignancy is listed first. That covers anemia as a complication. Let's move on to dehydration as a complication of the cancer or treatment for the cancer. So a patient may have dehydration associated with the cancer, but it's only being seen for the dehydration. List first a code for the dehydration, that's the E86.0, then a code for the malignancy. On the other hand, patient has dehydration associated with cancer, but is seen for treatment of both the dehydration and the malignancy. The same codes are used as in the previous slide, but in this case, the malignancy is coded first. So they're seen for treatment of dehydration and the malignancy. The malignancy is the bigger issue here, so that is listed first. Now, a patient can develop dehydration due to the treatment, the immunotherapy, chemotherapy, radiation therapy. In this case, list first a code, and the patient seen for treatment of both during this visit. So list first a code for the malignancy, and then dehydration and adverse effect, depending on which one of these is appropriate. So if the patient received chemotherapy, immunotherapy, or radiation therapy and then develops dehydration associated with the therapy during this encounter, that's the important difference here. And just like we saw before, you're going to do first code for encounter for treatment, a Z51 code, malignancy, dehydration, adverse effect. So it's the same as the previous slide, it's the same as it was for anemia, that first you do the Z51 code, whichever one is appropriate. Here's another practice case. If you'd like to work on this out yourself, pause the video. So the case is the patient has dehydration due to chemotherapy and has carcinoma of the breast. The dehydration is due to the treatment, the chemotherapy, and only the dehydration is being treated during this visit. Okay, so first you're going to list a code for the dehydration, and then the malignancy and the adverse effect of the chemotherapy. Okay, a patient may be seen for treatment of a pathological fracture and the malignancy, or may have a pathological fracture and the malignancy. Bone cancer can result in weakened bones and possibly a pathological fracture. So in this case, only the fracture is treated. So code first the pathological fracture from the M84.5 subcategory, which includes extra digits to be more specific for the site of the fracture, and then use a code for the neoplasm. So a patient may be seen for treatment of both the pathological fracture and the malignancy. So in this case, we're going to do the malignancy first and then the pathological fracture. The main focus, the bigger concern in this case is the malignancy, so it's going to be coded first. So what else can go wrong? Well, sometimes a patient develops pain associated with the malignancy. Now, if the patient is seen only for treatment of the pain, not the malignancy, just the pain, code first neoplasm-related pain, G89.3, and then the neoplasm. Note that the guidelines state that G89.3 is used if it's acute neoplasm-related pain or chronic neoplasm-related pain. Either one of those, it doesn't specify acute or chronic. On the other hand, a patient may experience pain due to a neoplasm and is seen for treatment of both the pain and the neoplasm. You can guess how this is going to go. What's the main focus of this? The main focus is the malignancy. The bigger issue is the malignancy. So code first the malignancy and then the pain. The guidelines state that if a patient is seen for treatment of the cancer and the pain is also documented, it doesn't necessarily say treated, but documented, code first for the malignancy and then for the pain. And do not list an additional code for the site of the pain. And lots of the pain codes you list a site because the malignancy is of a certain area, and that presumably is the site or the origin of the pain. So that would be captured in the specific neoplasm code. Here's another practice. So I will read it, and if you'd like to do it on your own, pause the video. So this patient has cancer of the bladder neck and is seen for treatment of pain related to the malignancy. Both the pain and the malignancy are treated during this admission. Okay, so first you're going to do the cancer, C67.5, and then the pain, G89.3. And again, the cancer code is listed first. So it's a very sad occurrence that sometimes cancer is diagnosed in a transplanted organ. So very specific guidelines on how to do this. So patient got a transplanted organ and then they diagnose malignancy in that organ. So first you do a code for transplant complication, and that's from category T86. Then a code for neoplasm of transplanted organ, and a code for the malignancy, which will give you the specific site of the neoplasm. So 3 codes. Next, I'll talk about complications from surgical treatment of a malignancy. So if the patient is seen for treatment of a complication due to surgical treatment of a neoplasm, list first a code for the complication and then a code, and then a code for the malignancy. So here's another practice. Again, pause the video if you wish. So this patient is seen due to hemorrhaging of the intestines. 2 days ago, surgery was performed to treat colon cancer. The colon cancer is still being treated. So the patient, the first code is the complication, post-procedural hemorrhage, and then the colon cancer. So the current condition, what the patient is being seen for this time, is the hemorrhaging. This is the more immediate problem. You can think of it that way. So that's why it's listed first. So other complications, lots of other possible complications. One is malignant pleural effusion. So there's a tumor in the mediastinum, the area between the lungs. It interferes with the drainage of the lymph system, and so fluid accumulates. So list first a code for the neoplasm and then a code for the effusion. How do you know that? It says, a note under J91.0, list first underlying neoplasm. So that tells you the order. Another possible complication is malignant ascites. In this case, fluid collects in the abdomen instead of the mediastinum. So list first a code for the malignancy and then a code for the ascites. And again, under this code, which is in the signs and symptoms category, there's a note that says code first malignancy. So that's how you know. A complication may also occur when a patient receives brachytherapy to treat a malignancy. So the patient is getting insertion, implantation of radioactive elements to treat the cancer. So in this case, the guidelines say list first a code for the malignancy because what's being treated in this case? The malignancy. Then list a code for the specific complication of the brachytherapy. Could be nausea, could be vomiting, could be dehydration, could be a lot of different possible things. So the patient is getting radioactive elements inserted and experiences a complication. There are so many possible complications, unfortunately. The general rule is that you list first a code for the complication and then a code for the malignancy, unless there are other guidelines as discussed earlier in this video. So here's an example. Patient with pancreatic cancer seen for initiation of total parenteral nutrition for cancer-related moderate protein calorie malnutrition. So what you do is list first a code for the malnutrition and then a code for the malignancy. So the complication is listed first. Okay, so let's summarize what we've done because this has been a lot of interesting guidelines. So here's a summary. In most cases, this is for anemia. In most cases, the malignancy code is listed first, except when it's patients being seen for treatment of anemia due to chemotherapy, immunotherapy, or radiation therapy. So here you have, in these cases, the malignancy is first. In this case, the malignancy is first. This is due to treatment. This is due to treatment. So another code is listed first. So let's look at coding for dehydration and malignancy. The difference between dehydration as a complication and anemia as a complication. For anemia due to malignancy, code first the anemia. For dehydration due to malignancy, code first the dehydration. So you see for these two cases, the malignancy is done first, followed by the dehydration. So it's a little bit different. That's part of the confusing part, that it's not consistent. Here's a summary of the guidelines for coding fractures due to anemia and coding pain due to anemia. The guidelines are consistent for both of these. So the principal diagnosis, the first diagnosis is when only the pain or the fracture is being treated. That's listed first, followed by the malignancy. If they were do treatment of both, then the malignancy is coded first, and then the pain or fracture is coded second. For other complications, the complication is usually listed first. The exceptions are pleural effusion, malignant ascites, and brachytherapy. So here we have these: transplanted organ surgical treatment complication is first. These, the malignancy is first, and other complications that we haven't discussed. There's so many possibilities. The complication is listed first. So look for the guidelines or for notes under a code like there are for effusion and ascites, so that you can will help you determine which one is first. It is impossible to remember all these guidelines. Here's some suggestions of notes to write in your book to help you remember the guidelines. So first we'll talk about the alphabetic index. Under anemia due to, it has chemotherapy, but it doesn't have the immunotherapy and the radiotherapy in there. So write them in alphabetically where they would be, so you know right away, because these codes are other anemias, but immunotherapy and radiation therapy are coded with the D6489. So then go to the tabular list. You can do the same thing, so you have it in two areas. Go to D64.89 and write in due to immunotherapy or radiotherapy. Also find code T45.1X5, write in chemotherapy, immunotherapy. For radiotherapy, see Y84.2. Okay. You can also go to Z51, because that can be kind of confusing. And it's in there, but you have to kind of read it, so just kind of circle it so it jumps out at you when you look at it. Z51.0 is radiotherapy. Z51.11 is chemotherapy. Z51.12 is immunotherapy. Okay, so that completes this video. If you have questions or comments, please feel free to contact me. If you would like to purchase a copy of the slides used for this video, contact me at terry.tropin@gmail.com. Right here. If you enjoyed this video, please give it a like and subscribe by clicking on the picture in the lower right-hand corner. So again, here are the books that I have written right here. These are available on Amazon. You can go into this link here, or you could just go to Amazon, type in, go to books, type in Tropin, and these will come up. Thank you so much for listening. Hope you will look at some of the other videos that I have. Thank you.